Hello everyone and welcome to our video on Ampreloxetine and its role in treating neurogenic orthostatic hypotension or NOH. In the next few minutes, we'll cover what NOH is, how Ampreloxetine works, and why it is an exciting treatment option for this condition. Let's start with an introduction to NOH. Neurogenic orthostatic hypotension is a condition where a person experiences a drop in blood pressure when transitioning from laying down or sitting to standing up. This can lead to symptoms like dizziness, fainting, and fatigue, which can significantly affect a person's quality of life.
Ampreloxetine was discovered by one of the fundamental community of the world known as Severance Biopharma.
Pharmacodynamics describes how ampreloxetine exerts its effects in the body. As a selective norepinephrine reuptake inhibitor, it blocks the norepinephrine transporter in nerve synapses. This leads to increased norepinephrine levels, enhancing sympathetic nervous system activity and improving blood pressure regulation, particularly in patients with neurogenic orthostatic hypotension. Unlike non-selective reuptake inhibitors, ampreloxetine minimizes serotonin and dopamine interactions, reducing the risk of off-target effects.
Pharmacokinetics refers to how the body processes ampreloxetine after administration. The drug is orally bioavailable, meaning it is absorbed effectively from the GI. Once absorbed, ampreloxetine reaches plasma peak concentration within 4 to 6 hours. It is highly distributed across tissues and primarily metabolized in the liver, undergoing CYP enzyme-mediated metabolism. The major route of elimination is through renal excretion, with an elimination half-life of 40 to 30 hours, allowing for once daily dosing.
Ampreloxetine has undergone multiple clinical trials to assess its safety and efficacy. In phase 2 trials, it showed significant improvements in standing blood pressure and symptom relief for patients with neurogenic orthostatic hypotension. However, in phase 3 trials, the drug failed to demonstrate a sustained benefit over placebo, leading to a halt in further development for neurogenic orthostatic hypotension treatment. Despite this, researchers continue to evaluate its potential in other neurological conditions such as fibromyalgia and chronic fatigue syndrome.
Like any medication, ampreloxetine does come with potential side effects. The most common include nausea, dry mouth, and insomnia. Some patients may also experience an increase in blood pressure, which should be monitored, especially for those with pre-existing heart conditions. Tachycardia and increased heart rate and headaches are also possible, while ampreloxetine generally has fewer side effects compared to those other treatments for NOH, such as midodrine or fludrocortisone. Patients should always be monitored closely by their healthcare providers, particularly for any cardiovascular effects.
Ampreloxetine showed promise. Its inconsistent results call for refinements in dosage, patient selection, and potential combination therapies. For future research may focus on long-term efficacy studies, personalized medicine approaches, and formulation improvements for better bioavailability. With ongoing innovations in drug development, ampreloxetine's potential applications could extend beyond neurogenic orthostatic hypotension, shaping future treatments for neurological disorders.
In summary, ampreloxetine is a selective norepinephrine reuptake inhibitor with a complex pharmacokinetic and a pharmacodynamic profile. Though its clinical trials for the neurogenic orthostatic hypotension had mixed outcomes, the drug remains an existing prospect for the further research and the development. Thank you for watching. Stay tuned for the more updates on the emerging pharmaceutical innovations.